Hello, I'm Jonathan Marks here with Anthony Rostain, MD, who is Professor of Psychiatry and Pediatrics at the Perelman School of Medicine at the University of Pennsylvania. He's also the Medical Director of the Adult Developmental Disorders section of Penn Behavioral Health. Dr. Rostain is the current president of APSARD, the American Professional Society of ADHD and Related Disorders, which is having their 7th annual meeting in Washington, D.C. at the Mandarin Oriental Hotel this coming January 15th to 17th, 2016. Dr. Rostain is going to deliver an address about the state of APSARD, its achievements and future direction. Dr. Rostain, what are a few highlights in APSARD's development over the years?
This is really a watershed meeting because we are bringing together a stellar group of presenters. So the first thing I'm going to mention is that we now have several hundred members and expect to have several hundred attendees at this meeting, which will be about the state-of-the-art of the clinical science of ADHD. Important growth of the organization and its diverse board are some of the accomplishments that I'm going to speak to. We have global experts in fields like psychiatry, epidemiology, pediatrics, psychology, ethics, all of whom are devoted to bringing their expertise together to work on the mission of the organization, which is to improve outcomes for individuals with ADHD and their families, both through research and disseminating evidence-based practices and education. We've grown also in terms of our international links. And not only that, but APSARD has developed an affiliation with a number of other important organizations, and we also have a journal. The Journal of Attention Disorders is now the leading journal publishing research on ADHD in the United States. It is becoming a much more highly cited journal. We are very, very thrilled with the active participation of our board of directors as reviewers for the journal. Furthermore, we've launched on our website educational activities for members. We've also helped to develop a website that's aimed at primary care practitioners called ADHDinadult.com, and this has been a very successful campaign to educate primary care practitioners about how to recognize and treat adults with ADHD. Last but not least, we have other exciting plans for the coming year with regional meetings and outreach to other organizations so that we can continue the discussion that we will be having in Washington.
Why should I attend this meeting? Is it just for specialists? What would I get out of it as a general practitioner?
Well, as a general practitioner, it would allow you to meet with experts and ask them questions about how to best address ADHD in your practice. It would also help you to understand where the field is going with respect to the science of ADHD, everything from understanding more about sleep disorders, comorbid psychiatric conditions, and lifestyle issues in ADHD. So you'll have a chance to both improve your knowledge base and also bring home some good ideas for addressing these problems that are facing your patient.
Great. So this is Dr. Anthony Rostain. He's the current president of APSARD. He will be delivering a major address about the state of the organization at the Mandarin Oriental Hotel this coming January 15th to 17th at the 7th annual meeting of APSARD. We look forward to seeing you there. Dr. Rostain, thanks for being with us.
Delighted. Thank you.